I think calculating crude mortality rate by looking at how many have died versus how many people have been infected is not a useful exercise. I don't think it tells you almost anything. So first, let's just be very clear about what a mortality rate would be. So right now in India, as I see it, there, as you said, maybe about 4 lakh or a little less in number of cases, right? That's how many we've had. About 12,000 people have died from this virus. So the mortality rate is number of deaths over number of cases. If you are missing many, many cases, right, because you're not testing enough people, then the number of cases you have is too high, and your number is too high. If you found more cases, your mortality rate would come down. So the 3% mortality rate is too high. That's actually, I don't think that is India's mortality rate. But the 12,000 deaths assumes that you're capturing everybody who has died from coronavirus and that you have a surveillance system for mortality that is perfect. We don't think that's true. So there may be many more deaths that we are missing. So neither the numerator nor the denominator is reliable. One more problem with mortality rates, which is if tomorrow 13,000 people get infected, they become part of the denominator, the number of cases. But death takes 2 to 3 weeks after infection. And so there's always going to be a lag. And so until that lag is over, you don't know which of those 13,000 people will die. So it looks like all those 13,000 people are still alive today. It looks like none of them are going to die. But of course, in 2-3 weeks, some number of those will die. Every country in the world loves talking about their mortality rate. And generally, most public health experts, epidemiologists, physicians and infectious disease experts, I think the entire community finds this exercise puzzling. It's not useful. Now, one other last point about this, and then I'll stop, is that countries' mortality rates are going to differ based on patient population. One of the hardest hit places was Northern Italy. Northern Italy has a very old population. So their mortality rate is going to be high simply because they have a lot of older people. And India has a relatively younger population. It's one of the things that assures me about India. It has a relatively younger population. So I expect that the overall mortality rate when this whole pandemic is over will be lower in India. But I don't believe that there is some miracle therapy that India has that other countries don't that is lowering the mortality rate. I would not focus on that. I think it is a distraction. Now, it seems like, of course, recovery rates should be useful. We want to look at what proportion of people recover. Here's the key point. We think for this virus, 99% of people recover. This is another statistic that is not useful. Let me explain why. When the pandemic is over, the recovery rate of almost every country will be close to 99%. Now, you may not see it in your statistic because you may not be capturing mild cases. So if a country captures its mild cases, then its recovery rate will be higher. If it only tests very sick patients, many of whom die, its recovery rate will be lower. But there's nothing different about the treatment or actually the disease. It's just about who you're capturing in your testing. So imagine that, if you only capture your young, healthy people, they're the only ones who get tested, you will have a very high recovery rate. If you only test older, sicker people, you'll have a very low recovery rate. tells you nothing about the disease. It just tells you about the population you're testing. Another statistic that gets a lot of attention that I wish people would not pay attention to. There are 3 or 4 statistics that are very, very important to pay attention to. Recovery rate and crude mortality rate are not among them.